Hi, my name is Marie, and this portion of the presentation, I'll be discussing discharge planning and plan of care, particularly with Ms. White's issues and postoperative status. Ms. White's road to recovery starts with an individualized care plan that addresses her postoperative needs. In terms of post-op diagnosis, she is post-op day 4 with status post-colectomy and post-op day 1 with status post-exploratory laparotomy or XLAP due to perforated bowel and peritonitis. In terms of mental status, she appears drowsy due to post-anesthesia, but oriented to person, place, and time. In terms of drains, tubes, and dressings, and GI status, she is NPO with NG tube to low well suction continuously, with IV fluids infusing LR at 125, and small abdominal dressings, clean, dry, and intact. However, abdomen was noted to be slightly distended with colostomy and JP times 1 to abdomen in place. Now, when discharging a patient, it's not only the doctor and the nurse, but discharge planning involves an interdisciplinary care team consisting of healthcare professionals from various disciplines providing care and discharging a patient safely. So we have, um, you know, a variety of teams such as the wound care team, which are responsible for assessing wounds and skin breakdown, pressure ulcers, sores, deep tissue injuries, and stomas such as colostomies as well. Then we also have case management and social work, who are responsible for having resources available to the patient after discharge, whether be it they discharge, to their home or to another healthcare facility. Um, Basically, they have to make sure that everything is in place. So once the patient arrives home or to a facility, the resources are made available to them. Then we also have the doctors, which is not only one doctor but several, consisting of the residents, and you have the attendings, and you can have consults, such as depending on the client's need, the primary care doctor might order a consult for neuro consult or for GYN consult or a consult for psych, depending on the current situation or status. And also, finally, you have the patient's primary care physician or a PCP. Then we have the nutritionist and dietitian that is responsible for or can make recommendations for meal plans for the patient. And in nursing, we not only have the RNs, but there's also the LPNs, the PCAs, the CNAs. You have the clerks and the home care nurses, both LPN and RN, that deliver care once the patient is discharged from the hospital. It's kind of like a continued care, or to provide that for the patient. And lastly, there's also therapy, which consists of, the physical therapists or, occupational therapists that help in assisting if the patient can ambulate independently or needs assistance with ADLs or activities of daily living.